everybody. My name is Coupe, and I'm an athletic trainer at NYU Physical Therapy. And I want to thank you all for coming out here tonight to become more aware of concussion symptoms and how we assess and manage them on the field of play. So what's really happening with concussion and how does it happen? Well, concussion is typically caused by a violent, forceful blow to the head or body that is going to initiate a metabolic crisis. Now this metabolic crisis stimulates a certain chemical reaction that provides us with an imbalance of some sorts. And that imbalance causes us to elicit certain signs and symptoms because we're going to feel different. And we're going to touch on signs and symptoms a little bit in the future here. But before we get there, I want to go over where do we typically see concussions. All right, we see them in everyday life, but more importantly, on the practice field, the competition field. We see them in football, basketball, baseball, hockey. It could even be boxing, wrestling, you name it, it can happen anywhere. Now we're going to go into who's doing the evaluation. Well, preferably, we always want to have a licensed medical professional on staff so that we can go in and do a very thorough, very proper medical evaluation. Typically on the field, whether it's a secondary school, professional setting, or in a college or university setting, you're going to have a team physician or an athletic trainer that's going to initiate the assessment right on the spot. That being said, as of July 2012, New York State has mandated a law that requires all athletic trainers, coaches, PE teachers, and school nurses to complete a required training course every 2 years. And this is going to ensure that those responsible are up to date on management techniques when we're discussing concussions. Now we're going to get into the actual assessment and evaluation portion on the field. Just like any medical professional will tell you, it's very important that before you get to the scene, you have to survey your surroundings. And we want to do this because we want to rule out any type of emergency situation. All right? In this case, an emergency situation would entail an athlete being unconscious, an athlete being conscious but experiencing sharp, striking pain over the cervical spine. And if that is the case, either one of these situations, we know we have to immediately stabilize the individual athlete, we need to activate EMS, and we have to monitor that individual patient until that further medical attention arrives. As we go into the evaluation a little bit further, all right, if it's possible, you can't do palpation and feeling if somebody has a helmet on for lacrosse, hockey, or football. You don't want to remove the helmet whatsoever. But any other case, whether it's soccer, baseball, football, wrestling, cycling, we're going to palpate certain specific areas pertaining to your head. We'd like to palpate the front, the side temporal region, the occipital region in the back. We're going to go over the spinous process, your zygomatic arch. We're going to go over your maxilla and your mandible. And what we're really looking for are any type of depressions, somebody who is experiencing tenderness or pain. And if that is the case, we know this is something we need to document, and it could be the trigger of a red flag. So how do we evaluate even further? Well, I like to go into subjective information. And subjective, to give you an example, is information that you respond back to me after I ask you a question. Okay? And I like to start off with assessing somebody's memory, okay? Their actual cognitive memory. And I go into retrograde amnesia, which is stuff that you should remember prior to the injury. And I also will like to assess somebody post-injury, which is known as antegrade amnesia. When we're assessing the retrograde amnesia, I always like to ask simple, straightforward questions. And I look for straight, simple answers in return. I will ask somebody, an individual, an athlete, do you know your date of birth? Do you know where you are? Do you know your last name? Do you know your mother's maiden name? Do you know where you grew up? These are typically things that each one of us individuals, as human beings, should know the answer to if we haven't sustained a traumatic brain injury. That being said, on the other side of the coin, we want to assess information after the fact, after the injury has occurred. So I typically like to use 3 words. You can use any ones that you want to use. These are just the 3 that I was brought up with and I was educated to use. I use the 3 words purple, dog, and fence. And throughout the evaluation process, I may ask an individual athlete to repeat those back to me at any given time. And I expect them to be able to remember all 3. Now if they can't, then I know there's some type of dysfunction, some type of asymmetry going on within the cranial pattern. Now when we want to go into even further subjective information where you're responding back to us, it's always important to ask the athlete how they're feeling. You may feel groggy. You may have a headache. You may have ringing in the ears. You may not even be able to focus and concentrate and pay attention to detail, among many other things out there. You could be irritable, you may be lethargic, you may be angry, you could even be depressed, okay? These are all very common signs and symptoms that an individual athlete may elicit should they sustain a traumatic brain injury. Now we're going to go into the objective measures, and this is stuff that we can actually put qualitative or quantitative information into play. For example, somebody's height and weight. Those are straightforward, measurable types of material. And what we're going to go into for this seminar is the cranial nerve assessment. Now there's 12 individual cranial nerves, and we're not going to go through each individual one, but I want to discuss 2 or 3 that I think benefit the medical professional and the athlete themselves throughout this evaluation process. I like to use a pen because it allows me to assess your ocular motor movements in various planes and angles, from going side to side. You can go up and down at various angles, and you can come out and go in. All right? And typically, with a person who hasn't sustained a traumatic brain injury, there's going to be a very smooth, fluid reaction to that movement. Okay? Now, however, if somebody's sustained some type of concussion, some type of traumatic brain injury, there may be a jutting, a shaking, a bolting back and forth, and that's typically known as nystagmus. And that's, once again, something that we need to put down in our minds and document, because this could be the indication that somebody sustained a concussion. Now, the pen also is used as a double because I can use it as a light. Now, when we shine this into one eye, typically, if somebody is within normal function and hasn't sustained a brain injury or a head trauma, both eyes should constrict and dilate symmetrically. Now, if I'm going to shine that pen light into one eye and one constricts and one remains dilated, we know there's an asymmetry, we know there's a dysfunction going on within that cranial cavity. Going further into our objective measures, we want to always assess what's known as proprioception. And to simplify that, that's basically our balance and coordination and how we maneuver through time and space. Okay? I like to give our patients, our individual athletes, the example of it's how we go up and down steps, how we go up and off of a curbside, and how we go in and out of a car. We don't typically, and we don't commonly have to use our visual feedback to look down at our feet to know that our foot's going somewhere. We expect it to happen because we practice it throughout our lives. And it becomes a subconscious thought, but that's a very natural thought. But in order to evaluate that on the field, we're going to do steps known as the balance error scoring system that's going to allow us to assess that balance and coordination. And it's a very simple method to implement on the field. And as you can see behind me, you're going to do 3 to 4 steps with regards to how we evaluate your balance and coordination. And it's simply, you're standing with your feet together, hands on the hips, knees are going to be partially flexed, and we're going to close our eyes for approximately 20 seconds. All right, and we're going to repeat this with standing on one foot, then the opposite foot, and then finally in a tandem stance on a very steady, stable surface. And what we're looking for throughout this process is somebody flailing side to side, their arms are swaying, and we know there may be some type of dysfunction going on within their cranial cavity. With that being said, throughout this entire process, we're always going to continue to monitor. We always want to ask how the athlete is feeling. We want to know what's going on inside their mind and how their body is feeling. Because things may change. They may progress and get worse, or they may stay the same, or they may even, unfortunately, get worse. That being said, if we remember correctly at the beginning of this seminar, I asked the individual athlete at hand to remember 3 individual words. And those 3 words were purple, dog, and fence. And this is the time at the end of the evaluation, before I refer onwards and exhaust that, they're not going back in to return to play. That's when I ask that individual athlete to repeat those back to me. If they are unable to respond to me and tell me those 3 individual words, I know this is once again a red flag, and we need to document that. So what did we really learn today? All right, this brings me to 2 very important pieces of the puzzle. We became more aware by being here tonight, and I want to thank you all for taking the time out of your busy schedules, your busy lives, to come here and educate yourself and make yourself more aware of the responses that you may elicit as an individual athlete throughout a concussion injury. All right? We know that it's extremely important, to be honest, because that honesty needs to be at a premium. I say that because a lot of our picture is painted through the subjective information, the information that you, the individual athlete, is telling us about, the way you feel, Are you nauseous? Do you have a headache? And you can't lie about these things because unlike an orthopedic injury, sprains, strains, fractures, cuts, you name it, your brain is not a tangible part of your body on the field. So your honesty has to be at an all-time premium throughout this process. So I highly encourage you to be honest with any medical professional throughout the concussion evaluation, should you sustain one at some point in your future. If we're ever looking for more information, I know Dr. Varlotta obviously mentioned it, but I highly recommend going to the CDC website, the Center for Disease and Control, because they have a mountain of information pertaining to concussions and various other ailments out there that individuals may experience on the field of play. So if you need more legitimate, more credible information, once again, I highly recommend this. So thank you for your time tonight, and if you have questions, please hold them to the end, and we will be glad to answer them for you. Thank you.